Hey guys, so much breaking news. I know I didn't give you guys a lot of notice to be able to jump onto this live, but we've just had breaking news about Trump. I wanted to come and talk to you about him leaving Walter Reed to do his photo op and then come back to the hospital. And just looking at the news right behind me too, it seems that before he went on with Secret Service to take a ride outside the hospital, seems like he posted a video. He did a video that was posted on Twitter, etc., which I watched that as well. All right, let's break it down, and thank you guys for joining. Again, I know this is short notice. I just wanted to jump on really quickly. I had to address this. Literally, the news is on. I know your news is probably on, and you're seeing that Trump has left Walter Reed Hospital. So I'm Dr. Jen Caudle. For those of you who don't know me, I am a family doctor. If you haven't subscribed to my channel, I invite you to do so. Please consider joining my memberships as well. I want to give a shout out to all of my members out there. You guys are joining in. Let's jump right in. Right now on my news that I'm looking at right behind me, we have just gotten word that Trump has left Walter Reed in a motorcade with Secret Service to do a photo op, to wave, to sort of say hello to his fans and fans outside Walter Reed. Apparently, it says, I'm just taking a look, it says Trump returns to Walter Reed after photo op. So apparently he has now returned back to Walter Reed. I want to just break this down a little bit. This is something really important to talk about. Now, a couple things to note. From the video that we're seeing on the news, Trump was wearing a mask. It didn't appear that he was wearing an N95 mask, but I can't say for sure, right? It's possible that he had an N95 underneath the cloth mask. At least as a family physician, when I'm seeing patients in the office, I actually wear an N95 with a surgical mask on top of it. Can't say, but what we do see is what appears to be a cloth mask. He is traveling with Secret Service or aides or whomever. There are people in the front seat and directly in front of him, and presumably, obviously, a driver. At least the person that's directly in front of him seems to be wearing what's an N95. We know that N95 masks are pretty much the best masks that we have available to us in terms of reducing exposure and spread of coronavirus. Another thing to take note is that Trump is in a closed space. He is in a car. It's good that the windows are rolled up, right? Because he still has COVID-19, and this is what I want to talk about. However, we have to remember that there are also other people in that car with him. Yes, they are wearing N95s, but they are still there. This, to me, seemed like a great opportunity to talk about really what the guidelines are, what the CDC says, okay? So on the news, we can pontificate all day long saying, well, that doesn't seem like a good idea. Well, this seems like a good idea. Well, this is wrong and this is right. Okay, well, that's fine. And first of all, if you want to know what I think, I don't think this was the wisest of ideas to take this photo op, getting into a motorcade and doing this. I'll tell you why, okay? And it's based on the evidence that we have right now. Remember, we want to make our decisions based on the best evidence that we have. If you go to the CDC, and this is really our gold standard in terms of guidelines, the CDC's guidelines for someone who thinks they have COVID-19 or has COVID-19 and also has symptoms, which, by the way, that is Trump. We know he has COVID-19, he has symptoms. They are only able to be with other people, okay, after after at least 10 days since the symptoms first appeared, and at least 24 hours with no fever or without fever-reducing medication, and the other symptoms of COVID that they have are improving. There's some caveats with that, okay? But I'm going to go back and read that again. Someone in Trump's situation, according to the CDC, so he has COVID, he has symptoms. According to the CDC, you should not be with others until at least 10 days since symptoms first appeared. We are not quite there yet. And you've had at least 24 hours with no fever, and you're not taking fever-reducing medications like Tylenol or Motrin or things like that, and your other symptoms of COVID are improving. Look, I'm not here to judge, but I think this was a good reminder of what the facts are. There's many people, we've had over 200,000 deaths from COVID-19. Many of you know people who have COVID, have had COVID. You may have COVID right now or have had it yourself. These guidelines, I'm trying to mention them because they're not quite in line with what we're seeing on the news that's happening, okay? So if you have COVID, you got symptoms, it's a minimum of 10 days, assuming all of these other guidelines can be met, okay? Now, let's talk about for someone who tested positive for COVID but does not have symptoms. Now, by the way, that's not the president, because our president is symptomatic. But let's say you have COVID and you had no symptoms. Well, you still have to wait 10 days since the date you had your positive test. So 10 days, guys, still seems to be the magic phrase when it comes to being able to be around others. And today we're seeing our president doing a photo op, waving to supporters, but he is very closely around others in a closed vehicle. Yes, they are wearing masks. Some question might be as to what mask they're wearing. So I wanted to really, to make that point out. I would also say that the CDC has some caveats for people who had COVID-19 or have it, and they have a weakened immune system. Sometimes that length of time to be around others may actually be extended, okay? So that's really important to keep in mind, guys. I want you to know what the facts are, not necessarily, you know how parents sometimes say, do as I say, do as I say, not as I do. What we should be doing is, if you have COVID-19 and you have symptoms, you shouldn't be around other people for 10 days at least, as long as you've also met those other criteria that I talked about, being fever-free, symptoms improving, etc. Okay. Now, I also just want to just take a moment to bring up the point of quarantine. So remember the difference between isolation and quarantine. Isolation applies for someone who has COVID-19 or thinks they have it. We want to isolate them from others. So the president right now is, of course, in the hospital, but that's isolation. That is not quarantine. Quarantine is for people who have had close contact with someone who has COVID-19. In other words, the contacts of someone who's been diagnosed. That would be the contacts of the president. They should be in quarantine. This idea of quarantine is really about separating those who have been in contact with somebody from COVID-19 to make sure they don't in fact develop it themselves, okay? With quarantine, and I won't go through all the details, but understand, if you've been in contact with somebody with COVID-19, you need to quarantine for 14 days, okay? That is 14 days after your last contact with the person who has COVID-19. I bring that up as a distinction between isolation and quarantine. Also, the importance of thinking about all the people that Trump might have been around. It is important for them to quarantine, I must say. But going back to the photo op that he's done this afternoon, again, he got into the motorcade with presumably Secret Service, saw him on television. He waved to the crowds, seemed like he had a mask on, looked like a cloth mask, but we don't know if he had a different mask underneath it. Again, I've said this before, as a family physician, I wear N95s with a surgical mask on top, so I don't know if he had two masks on. It looked like Secret Service or other aides were directly in front of him, and then of course there was a driver. The aide or whoever was directly in front of him looked to be wearing an N95. That was a closed space, however. But going back to facts, this is for, I hate to say this is for the rest of us, but really the facts in terms of CDC says, if you have COVID-19, you really should isolate and not be with other people for at least 10 days after. Let me just I'm going to pull this up again because I want to make sure I read this exactly right. If you've had COVID-19, hold on, where are we? Okay. If you've had COVID-19 and you've had symptoms, you can only be with others after at least 10 days since your symptoms first appeared, and at least 24 hours with no fever or without taking fever-reducing medications, and your other symptoms of COVID are improving, again, with some caveats. Guys, I want you to think about this long and hard. The biggest thing for me is I want you to know what the facts are. I want you to know what the truth is. I want you to know what is right to do. Our whole name of the game right now is to protect ourselves and other people from COVID. If you get COVID, the last thing we want is for you to be spreading it to other people. And that is the purpose of these guidelines of isolation, and also the purpose of quarantine if you don't have COVID, but were exposed to somebody with COVID. Please, guys, take this to heart. Please do not think it's okay to be around other people if you have COVID. It's not, unless you've met these CDC requirements, and you really should be doing it under your doctor's care. Guys, we have a long ways to go. We need to fight this. We need to fight this COVID situation. I want you, please, to wear your masks. Encourage other people to wear masks. Please social distance. Stay away from groups. Hand sanitize. Wash your hands. Don't go to work or school. Don't send your kids to school if they're sick, or if you're sick. Don't go to work or school. We must not only look after ourselves, we must look after each other. Guys, those of you who are just joining, I'm Dr. Jen Caudle. Please share this video, by the way, with other people. And if you haven't subscribed to my channel, please do. So I want to jump in, guys. Thank you guys so much for joining. I was so into everything I was talking about. I didn't even get to get your comments. I'm going to get them now. Thank you for the super chat. Let's see here. Who sent super chat or super stickers? Belinda, you sent a super sticker. Thank you so much, honey bun. Appreciate your super sticker. I know you're also part of my YouTube membership. Please join memberships if you are interested. Joanne, you said crazy train. Yeah, it's a little insane right now. Carla, you said you're my favorite. Well, that's so sweet of you, Carla. Zachary's Journey, hello. Brian Jones, hello. Betty, hello. Daryl Wallace, hi. Note 20 Ultra is boss. I like that username. You said just for a joyride, he risked the lives of FBI agents. I would be lying if I didn't say I was concerned, okay? Belinda, again, thank you for the super chat. Sheila Thomas, you said this is crazy. Dr. Jen, do you think he actually has COVID? This is such risky behavior for somebody with COVID. A lot of people are questioning whether he has COVID or not. You know, this is me. I'm willing to take for face value what the medical physicians and our political leaders and reporters are saying. If they're saying he has COVID and he says it, I am willing to believe that. But I just need things to be as safe as possible while we work to get him better. And let me be very clear. We don't want anyone to have COVID. I don't want anyone to suffer from COVID. I don't want anyone to do poorly with COVID. I want everyone to get better, including our president, of course, and the first lady and everyone, Chris Christie and everyone else, non-politicians in this country and across the world. I want them to get better, okay? Let's see here. Brian Jones, is the 14-day waiting period still in effect? It is for quarantine, okay? Jason Smith, you said it looked like the cloth mask that he wears in photo ops. It may be, I'm not quite sure. I try not to speculate just because, you know, you just sort of never know by a picture. Brian, you said, is N95 masks better than sort of cloth masks? Yes, they are. One of the reasons why we don't recommend N95s for everyone is because they're in short supply and healthcare workers need them. So wearing a cloth mask for the everyday citizen who's not COVID infected, right? The key thing here, that's perfectly fine. It's completely different if you have COVID. Number one, if you have COVID, you shouldn't be around other people, which was the point to, you know, sort of my spiel today. That's really important. Let's see here. Mason, doctor, can you tell us the truth? Is it okay for someone with COVID to do that? I don't think it is. I know it's not. And that's why I read the CDC guidelines is, you know, without being pedantic about it, I'm trying to let you know that the guidelines say if you have COVID and you have symptoms, shouldn't be around others for at least 10 days from when symptoms started and your fever has gone away and all these other things that the CDC says. So please, please take that to heart. Another summer, you said, boy, do I have white teeth. You know, that's the one thing people always say about me. It's really sweet, actually. So for those of you who are wondering about my teeth, because a lot of people ask me about them. I just finished eating, so I was making sure nothing was in them. I have had braces twice. By the way, if you have children or you get braces, make sure you wear your retainer afterwards. I did not wear my retainer after the first time I got braces, so had to get them again. A few years ago, I got Invisalign the second time around. But I just use like Colgate whitening toothpaste. I don't even whiten my teeth because the stuff, like the whitening stuff, I have really sensitive teeth. So it just really kind of, my teeth are too sensitive. Honeys, I just use Colgate whitening. I think it's like Colgate, is it Optic White or something like that? Just buy you a whitening toothpaste. Let's see, I'm just taking a look. At the headlines, Trump back at Walter Reed after photo op, okay? Once again, we wish the president, first lady, and all politicians well. Guys, I really appreciate you joining me today. Again, if you haven't subscribed to my channel, please do. Please consider joining my memberships. I appreciate every single one of you, including my members. And thank you for those of you who have sent super chats and super stickers. I love it. Belinda, especially you today. Thank you for the super sticker. Guys, I'm Dr. Jen Caudle. As always, I will see you again. Please be safe. Wear your masks. Wash your hands. Stay out of crowds. All right, guys. Love you.